Tell me doctor now, what is your answer?
D.
Shamim proposes D.
D.
You also propose D.
A.
A is a proposal on X descent from none less than Venkat. Gautam also says D. Doctor, Y descent is because of what? Descent is a fall of pressure in the ventricle, I mean in the atrium. In the atrium. At the end of the diastole of the atrium, I am not talking about ventricular diastole. End of the ventricular systole is equal to end of the atrial diastole. Atrium got fully filled with the blood from the veins. Tricuspid valve opens. Blood runs into the ventricle from atrium and the pressure falls in the atrium and that leads to Y descent. Any tricuspid stenosis will not enable the pressure to dramatically fall down in atrium. Hence Y descent will not be prominent if there is a tricuspid stenosis. That is what you need to know. All waves, A wave, C wave, V wave, X and Y descent. Remember me doctor, you will remember in exam B, one question definitely come. Then one more common topic examiner love to ask you is constitutive pericarditis, restrictive cardiomyopathy, then differences, pericardial effusion and cardiac tamponade. Cardiac catheterization findings, what are the differences he love to ask. I leave to you the literature for reviewing. Okay, what is X descent doctor basically? Let us take up the point of view of Venkatesh. X descent is because of relaxation of the atrium. Atrium undergone systole doctor, it pumped everything into ventricle. Then atrium undergoes relaxation so that pressure will fall and blood has to move from great veins into atrium. That relaxation of the atrium lead to X descent is what you need to basically appreciate. Now shortly after S2 which will not happen?
Ejection click.
Excellent. S1 के बाद ejection click, S2 के बाद OS, S3 and S4. Between S2 S1 you call diastole, S1 and S2 you call it as systole. You must know which sounds are systolic, which are diastolic. Now comes the next question. Left bundle branch block में what do you classically come across?
Paradoxical split.
Paradoxical split of S2.
Paradoxical splitting, already we reviewed this. So this is an example of an LBBB and paradoxical splitting. Pulmonary embolism, what is EXCEPT? What is EXCEPT?
D.
64?
D.
You mean to say narrow splitting? Yes, it leads to the widening of the split because it will delay the pulmonic component from happening. Now, what is not a normal anion gap acidosis but a high anion?
Aspirin.
Salicylate intoxication, methanol, uremia, salicylates, ethanol, lactic acidosis, mud piles, and Edison, acetazolamide, renal tubular acidosis, diarrhea and pancreatic fistula. They all lead to HAART A, which is normal anion gap acidosis. SIADH, then diabetes insipidus, 2 types, psychogenic polydipsia. All laboratory findings 200% you should be sure. Common question. Yeah, what is your answer?
B. Diabetes insipidus.
B.
You like to say diabetes insipidus. Excellent. Basically, if you take SIADH, urinary specific gravity will be high because ADH excessively produced will lead to antidiuresis. No water going into urine specific gravity increase. Got it? That's right. Eaton-Lambert syndrome for myasthenia gravis. What is EXCEPT?
D.
I think today medicine is cakewalk. I mean other options are difficult. and the correct answer option is very easy and visible to you. That is a mistake of framing the questions. No problem. Actually, if you read well, answer will be very clear to your eyes. Otherwise, there will be colored halos with broken and unbroken rings. Which will break between cataract, glaucoma? Cataract is in lens, lens breaks, colored halos break. Now, 32 years old with AIDS, mass lesions enhancing to contrast, which will not enhance?
PML.
Today students are rocking the answers. PML, very good. This is the toxoplasmosis, doctor, most common CNS mass lesion. What is the closest differential diagnosis for this? Primary CNS lymphoma. For lymphoma you need to do brain biopsy. For this what you can do? Give pyrimethamine for 2 weeks. Whenever your retroviral patient has this kind of mass lesion, give him a trial. 2 weeks दे दो, repeat करो. अगर lesion छोटा हो गया तो your diagnosis is right. अगर नहीं हुए तो वो CNS lymphoma होगा, then you do brain biopsy. That is the rule. But if you take PML, it does not enhance, is a important rule. Right upper lobe infiltrate with right effusion. He is alcoholic, COPD is there. What is your diagnosis?
D.
Klebsiella.
Stamp or step?
Streptococcus.
Streptococcus pneumonia.
Lobar in consolidation.
You are not sorry, you are correct. Streptococcus pneumoniae is typically the most common organism in this given scenario. Eosinophilic, yeah. Any objections, please rise. We love to know from you.
Alcoholic upper lobe Klebsiella.
Alcoholic.
Klebsiella is interlobar effusion characteristic. Characteristic of Klebsiella is interlobar effusion, no sir.
वो तो है, but the point of view of Venkatesh is alcoholic COPD, right upper lobe infiltrate. We will check about Klebsiella. We will check about it. I believe the statistics are of late changing between the different organisms due to the type of antibiotic policies. But anyway, we will review that. Then eosinophilic pulmonary syndrome without peripheral eosinophilia. What is your answer?
A. Loeffler's.
Loeffler? But Loeffler will not have or will have peripheral eosinophilia. So Loeffler's is migratory pulmonary infiltrates and may or may not be with eosinophilia, means it is eosinophilic pneumonia. What is the inheritance pattern of Dukins?
X-linked
Dukins. Yeah, even our online students are saying Klebsiella should be the answer for the alcohol and COPD. We'll come back on that. Yeah, what's your answer? X-linked recessive. That's good. Untreated acromegaly.
Colon cancer.
Colon cancer.
Colon cancer. That's right. Which is not vitamin K dependent?
D.
8.
Factor 8.
Factor 8 is not involved. Very good. What is wrong about MI?
C.
We don't use calcium channel blockers unless we want to kill the patient. Because in acute MI already infarct has made heart to fail. On the top you are decreasing the inotropic state by giving calcium channel blockers unless he is the best rival of you. Then what is wrong about hyperparathyroidism? All other options are more difficult, but actual answer is very easy.
B.
Basically there can be a normal calcium with hyper increased parathormone is possible. What is that variant called? Normocalcemic hyperparathyroidism it is called as. That is possible, but not normal parathormone, and still you call it as hyperparathyroidism is unlikely.
Sir, C. Option C.
Primary hyperparathyroidism causes, yes, mild hyperchloremic metabolic acidosis. Why? This colovaridhi. See, these hormones have got effect on renal level and so many other areas. It's a little, you need to go through the literature. I mean, we have justified that in the literature how it will be responsible. Then amyotrophic lateral sclerosis, what is EXCEPT?
B.
B.
Painful weakness.
You want to say painful weakness?
Is wrong.
Except.
Any other answer? Now, there can't be any sensory symptoms, there can't be any autonomic dysfunction, there can't be any bladder or bowel involvement, then you call it as amyotrophic lateral sclerosis, which is a pure motor neuron disease involving the Hunter cells, is what need to be remembered. With this great man, without whom we can't pass this question, Stephen Hawking is what you need to remember, the highest IQ in the world. But for MD entrance you don't need high IQ. In fact, that can be a disqualification to get into a good MD seat. What you need is high yield topic pappu rubbing approach. You must be put in mixie and grind the topics, that is very, very important. Okay, doctor. Now abdominal pain in polycythemia, what is EXCEPT?
C. Pancreatitis.
C.
That is right, pancreatitis is not a part. What is wrong about NNRTIs among the heart?
A.
Huh?
A.
Very good, they have a long half life, not a short half life. What is about efavirenz?
Safe
One
in
confident
pregnancy.
answer?
Not safe in pregnancy. C.
That is good, they are unsafe in pregnancy, don't give it in the first trimester of pregnancy is the rule. What is wrong about skin lesions of SLE? Huh? Question number 80, online students should punch the answers. I am very happy Karim Nagar also is participating. Yeah.
A. A.
Malar erythema spares nasolabial folds. That is the speciality of the lupus rash. Huh? Then temper tantrums, why do they occur, doctor?
Behavior problem.
Behavior problems.
Behavioral problems.
Yes.
Why medical college lectures are boring? Not due to students, doctor, due to the teachers. So the point is bad parenting is all responsible to make rowdy children, and bad parenting is mainly responsible. Tetralogy of Fallot, what is the unusual complication?
Cardiac failure.
Cardiac failure.
Cardiac failure basically is not a usual feature of TOF, because the left ventricle has so many ways to go out. I mean right ventricle blood, it can go through VSD, it can go through overriding aorta, anywhere it can run, it won't stagnate in right ventricle. So cardiac failure is unlikely. Now doctor, what decides ductus arteriosus?
Prostaglandins.
Huh?
A.
Prostaglandins.
It is the oxygen, you breathe oxygen, ductus arteriosus opens up.
Sir, is it not like with the first breath of the baby, the partial oxygen increases, that will cause the pulmonary resistance to come down. So there is the metabolism of destruction of prostaglandin, hence the closure of ductus arteriosus.
That is not the reason. That's not the reason per se. You take a baby, throw into the ambient atmosphere after the birth. Automatically when he inhales the oxygen, which is of a higher concentration, that opens up, pops it open. Others are all secondary mechanisms, but main is that. As I told you, yeah, what is the answer?
7th week. 6th week.
Huh?
6th week.
6th.
6th is nearest to 7th than to 5th.
5th is nearest also, sir. Round figure 5th.
Then cardiac pulsation is 7th week, embryonic movements 8th week, yolk sac 6th week, fetal pole 6th week, gestation sac 5th week. ये तो without confusion याद रखना. because ultimately obstetrics is all about it. ये बोलो doctor.
3:1.
One question on CPR.
3:1.
3:1.
3:1. That's right. Neonate 3:1, 1 to 8, 5:1, greater than 8, 15:2 is the rule. A male toddler falls and lead to a hematoma. What is that?
Septic arthritis.
Hemophilia.
Septic arthritis.
Beautiful. Hemophilia.
Sir, warmth. Warmth.
Yeah, basically there is some amount of synovitis also because of that hemorrhagic effusion into the joint that makes joints become warm. Why not septic arthritis? The history of recurrent falls ultimately leading to the hematoma is unlikely story in the septic arthritis, and septic arthritis is more often an issue with adolescent male who is sexually active. Hypercyanotic spell, what is your answer?
Increased intensity of murmur.
That's right. What happens to intensity of murmur?
Decreases.
Why will it decrease?
Because
Why will cyanotic spell occur? Due to pulmonary route going into spasm, that will further decrease blood flow, murmur will come down. But what is the flaw in this logic? Murmur of the cough is due to VSD or PS?
PS.
VSD. VSD.
PS only, no, not VSD. If we say VSD, examiner allowed to fail us in exam. VSD is a low flow VSD. It does not lead to any murmur. The murmur which you listen, systolic murmur, is not due to VSD but due to the PS. What decides ultimate prognosis of cough?